What is high blood pressure, which is hypertension? Let's find out more. High blood pressure is a common condition in which the long-term force of the blood against your artery walls is high enough that it may eventually cause health problems, such as heart disease. Blood pressure is determined both by the amount of blood pressure your heart pumps and the amount of resistance to blood flow in your arteries. The more blood your heart pumps and the narrower your arteries, the higher your blood pressure. You can have high blood pressure, which is hypertension, for years without any symptoms. Even without symptoms, damage to blood vessels in your heart continues and can be detected. Uncontrolled high blood pressure increases your risk of serious heart problems, including heart attack and stroke. High blood pressure generally develops over many years, and it affects nearly everyone eventually. Fortunately, high blood pressure can be easily detected, and once you know you have high blood pressure, you can work with your doctor to control it. Symptoms. Most people with high blood pressure have no signs or symptoms, even if blood pressure readings reach dangerously high levels. A few people with high blood pressure may have headaches, shortness of breath, or nosebleeds, but these signs and symptoms aren't specific and usually don't occur until high blood pressure has reached a severe or life-threatening stage. There are two types of high blood pressure: primary essential hypertension. For most adults, there is no identifiable cause of high blood pressure. This type of high blood pressure, called primary essential hypertension, tends to develop gradually over many years. Secondary hypertension. Some people have high blood pressure caused by an underlying condition. This type of high blood pressure, called secondary hypertension, tends to appear suddenly and cause higher blood pressure than does primary hypertension. Various conditions and medications can lead to secondary hypertension. Risk factors. High blood pressure has many risk factors, including age. The risk of high blood pressure increases as you age until about age 64. High blood pressure is more common in men. Women are more likely to develop high blood pressure after age 65. Race. High blood pressure is particularly common among people of African heritage, often developing at an early age than it does in whites. Serious complications such as stroke, heart attack, and kidney failure also are more common in people of African heritage. Family history. High blood pressure tends to run in families. Being overweight or obese. The more you weigh, the more blood you need to supply oxygen and nutrients to your tissues. As the volume of blood circulated through your blood vessels increases, so does the pressure on your artery walls. Not being physically active. People who are inactive tend to have higher heart rates. The higher your heart rate, the harder your heart must work with each contraction, and the stronger the force on your arteries. Lack of physical activity also increases the risk of being overweight. Using tobacco. Not only does smoking or chewing tobacco immediately raises your blood pressure temporarily, but the chemicals in tobacco can damage the lining of your artery walls. This can cause your arteries to narrow and increase your risk of heart disease. Secondhand smoke also can increase your heart disease risk. Too much salt, which is sodium, in your diet. Too much sodium in your diet can cause your body to retain fluid, which increases blood pressure. Too little potassium in your diet. Potassium helps balance the amount of sodium in your cells. If you don't get enough potassium in your diet or retain enough potassium, you may accumulate too much sodium in your blood. Complications. The excessive pressure on your artery walls caused by high blood pressure can damage your blood vessels as well as organs in your body. The higher your blood pressure and the longer it goes uncontrolled, the greater the damage. Uncontrolled high blood pressure can lead to complications including heart attack or stroke, aneurysm, heart failure, weakened and narrow blood vessels in your kidneys, thickened, narrowed, or torn blood vessels in the eyes, metabolic syndrome, trouble with memory or understanding, dementia. Those are some of the things out of many that high blood pressure can cause if it's not controlled. Everyone wants to know how to either cure, treat, or make it a lot better high blood pressure, or what they call a hypertension. Everyone want to know what can they do to get rid of it or treat it. I would like to read something to you. How can I prevent high blood pressure? Preventive care is the leading cause to making it not happen if you don't already have high blood pressure. Eating a healthy diet to help manage your blood pressure. You should limit the amount of sodium that you eat and increase the amount of potassium in your diet. Getting regular exercise, being at a healthy weight, limiting alcohol, not smoking, and managing stress. Those are some of the things that you can do to do preventive care for hypertension. We will give you the 4 basic things that you can either cure it, treat it, preventive care that you can take on an everyday basis that can help you. And one of those things is honey. Blood pressure is an important risk factor for heart disease, and honey may help lower it. This is because it contains antioxidants, compounds that have been linked to lower blood pressure. Studies in both rats and humans have shown moderate reductions in blood pressure from consuming honey on an everyday basis. Garlic is also another natural thing that you can use to lower your high blood pressure. Some research suggests that garlic increases the body's production of nitric oxide, which helps the smooth muscles to relax and the blood vessels to dilate. These changes can reduce hypertension. One study reported that garlic extract reduced both systolic and diastolic blood pressure in hypertensive people. And another one is niacin. Niacin helps also. And also another one that helps lower blood pressure is Oil Pure BP. That also helps. That's the 4 basic things that you can use on a daily basis that can help yourself. But always consult with your doctor before using any of these things on a daily basis. Vitamin Health Awareness would like to make a hypothesis on what they think it could truly be. Artery blockage can cause hypertension. I'm going to explain. If you eat all the wrong foods, drink all the wrong drinks, and put a lot of sodium and not work out or do the things you're supposed to do, what is going to happen is, I'm going to explain what is going to happen is, the artery's going to clog up. Like a car's engine. You got a change the oil in order for the car to run. Other than that, it'll clog up and shut down. That's basically your arteries. Your arteries get clogged up, which makes it harder for the blood to be pumped through to where it needs to go through. And when that happens, it creates hypertension. Now, I'd like to read something to you. What kind of foods clog your arteries? This is very important. Avoiding overindulging on ice cream, whole milk, butter, sour cream, cream cheese, egg yolks, fatty meats, fast food, fried chicken, breaded chicken or fish, pastries, and chips. These foods tend to contain saturated fat and trans fat. Cut back on drinking too. Clogged arteries can cause these symptoms: chest pain, shortness of breath, heart palpitations, weakness or dizziness, nausea or sweating.